Hi, another video about Big Pharma today because it's just the gift that keeps on giving. You've probably already heard that Merck has developed a new anti-COVID drug and it's planning to charge for it 40 times more than its production cost. And to top it all off, the research of this drug was subsidized by taxpayers' money. Isn't that fantastic? And it's not an isolated case. This is not something out of the ordinary. This is a direct result of how this industry is organized. Let me go over some facts here. Fact number one. A lot of research and development is publicly funded. Everything unprofitable or risky is funded by taxpayers because private firms just won't do risky early on research. And also they won't research anything that cannot be patented. A study from the National Academy of Sciences shows that the government spent $100 billion to subsidize the research on every single one of the 200 plus drugs approved for sale in the United States between 2010 and 2016. A link to the study is down below. But taxpayers do not get anything in return for all this funding. Private pharma gets all the profits anyway. Fact number two. Pharma companies price gouge people a lot because they can. Normal market mechanisms do not work as well in healthcare industry. For example, if you see overpriced jeans or shoes, you will buy cheaper ones from a different firm or won't buy them at all. But if you're lying there and dying of COVID, you will pay anything Merck wants you to pay for the patented drug. The invisible hand doesn't work well in healthcare. Fact number three. Pharma companies spend most of their giant profits on stock buybacks, dividends, and marketing, and not on research and development. An article in Washington Post by Anna Swanson can give you an idea about how huge their marketing budgets are. On the graphic, you can see that 9 out of 10 biggest pharma companies spend more on marketing than on research. Same goes for stock buybacks. Pharma companies spend billions more on stock buybacks and dividends than on research and development. The article and the report to back that up will be below. And of course, the worst part of this system is the fact that it prioritizes profitable treatments over others. And by others, I mean the treatments that cannot be patented or the ones that are off patent. It costs us lives, it causes needless suffering. It costed me personally several years of my life that I will never ever get back. I talked about that already and gave you factual evidence that this is happening. The link to the video where I did that will be in the description. So, to sum it all up, huge part of research and development is subsidized by taxpayers. People are paying insanely high prices for the drugs very often. All the profit goes into private pharma companies and the overwhelming majority of this profit goes to fund things that have absolutely nothing to do with innovation. And of course, people get less than optimal care because the system prioritizes profitable treatments. David Sirota wrote about the situation in The Guardian, and here's how he described it. That's not a free market. It's a top-down command economy perfectly calibrated for price gouging, and the pharmaceutical industry and its puppet politicians want to keep it that way. And I agree with him on that. This is not free market anymore. Big money found its way to big power and created corporate totalitarianism. And it harms not only the US citizens, people all over the world feel the effect of that. Restoring actual free market might take care of excessive cost of medications to some degree, maybe. But it will not take care of less than optimal care caused by prioritization of profitable treatments. Off-patent drugs and treatments that cannot be patented lose in free market. That's just what it is. Regulations we have in place right now clearly do not work. They could have worked in a perfect world filled with perfect moral people, but not in reality. I think that a system where you get filthy rich for discovering a patentable treatment and you get almost nothing for discovering a treatment that cannot be patented will always produce less than optimal outcomes. I think that nationalizing this industry entirely is a better solution. It can create a system where people's paychecks depends on how well the treatment works and not on how much of it can be sold. And it can make outstanding researchers the real beneficiaries of the system instead of the executives. And in such a system, hundreds of billions of dollars won't be spent on stock buybacks, dividends, and useless and harmful advertising. Anyway, these are just my thoughts. I don't claim to know everything. This topic can be debated and discussed. Maybe there are some possible solutions that I don't see. The one thing that I know for sure is that the current system is a giant mess, not only financially but also medically.